All right. I'm Angie Ochoa, and this is my head to toe physical assessment video for nursing 210. I'm going to go ahead and be assessing my daughter. She is a pediatric patient, and so a little bit of the assessment will be adjusted to be appropriate for her level of development. Thank you for your time, and I look forward to doing this video. Here we go. All right, Madeline. So my name is Angie, or Mommy to you. And I am going to be your nursing student today. So the first thing that I always do when I walk into a room is going to be hand hygiene. I'm going to have you scooch over just a couple scooches. Perfect, just so we can both be in the camera. First thing I do is hand hygiene. Okay. Introduce myself. My name is Angie, your Harper College nursing student. Sweetie, can you verify your name and date of birth with me?
My name is Madeline Ochoa. You know that because you are my mother. I was born in the year 2008, and then my birthday is February 14th.
Wonderful. So before I ever begin any type of assessment, the very first thing that I'm always looking for when I walk into a room is airway, breathing, and circulation. And just by looking at Madeline, I can see that her airway is open, she's breathing appropriately, and by touching her hands at her circulation is intact. They're warm. I don't see any signs of cyanosis. And since those basic safety measures are taken, I would go ahead and then begin my head-to-toe physical assessment. So I can tell that my patient is obviously alert. And Madeline, can you tell me what year it is?
2016.
Wonderful. And where are we right now?
Mommy's kitchen.
And what are we doing?
Making a nursing video so you can pass your professor's test.
Cool, perfect. And then also one last quick question. Who is our president?
Donald Trump.
And is he our new president or our old president?
New.
Okay, wonderful. You're very smart. So we can tell that the patient is alert and oriented to person, place, time, and thing. The very next thing that I want to talk about is earlier we did the Snellen chart in which Madeline stood 20 feet away from the letters on the wall. We had her cover each eye and determined that both her right eye and her left eye are both 20/20 vision. That shows me that cranial nerve number 2 is intact and working wonderfully. The next thing that we'll talk about today is your body mass index.
Okay.
So Madeline, being a child, is actually 4'11" and she weighs 80 pounds. Upon the children's BMI chart, she does come in at a 16.2, which is within a normal limit for right now.
Okay.
Does that make sense?
Yeah.
Wonderful. The next thing that we'll talk about is her vitals. Earlier we did her blood pressure, her respirations, her temperature, as well as her radial pulse. And her blood pressure was within a normal limit, 86/52. Her heart rate was 62, her temperature was 36.2, and respirations were 16. And so those vital signs help us to see kind of what's going on with our patient a little bit. And so by judging by those, I can tell that right now you're feeling okay and everything is within normal limits.
Okay.
Okay. The very next thing that we're going to talk about, are you okay to keep going or do you need a break?
I'll keep going.
Okay, wonderful. The very next thing that I want to talk to you about a little bit is your eyes. I'm going to actually do a test in which I have you follow my pen with your eyes, okay?
Okay.
So we'll do eyes in just a second. Before I get started with that, I wanted to take a look at your head.
Okay.
And what I'm looking at right now is just to kind of gauge if her head is the normal shape, which would be round and appropriate size for her body frame, in which it is. And I can see just looking at it, left to right, it is symmetrical. From front to back, I do see a normal curvature and round shape of the head, so we would call that normal cephalic shape. The next thing that I'm going to do, sweetie, is I'm going to actually palpate your scalp. And so what I'm doing is feeling for any bumps, any lacerations, areas of sponginess. Obviously in this age group of pediatrics, there is no soft area left. Her skull is fully formed and the fontanelles have fused. And so that being said, did that cause you any pain at all?
No, Mom.
Throughout that, I'm also going, hands down, I'm also going to be looking throughout the hair, looking for any signs of lacerations or infestations, any other thing that would be a cause for concern, of which I don't see any at this point. Wonderful. You can put your headband back on now, okay, honey?
Okay, Mommy.
Like I said, the next thing that we're going to look at
Is it my eyes?
are your eyes. Wonderful. So what I'm going to do is I'm going to have you follow my pen. Now, what I want you to do is just follow it with your eyes.
Not my head.
Not your head. And so this will be taking her through the 6 cardinal gazes, and it will be testing cranial nerves number 3, 4, and 6. So go ahead and follow this. I'm ensuring to come back to the center each time that I do a cardinal gaze. I see that her extraocular muscles are converging simultaneously and strongly. And again, this lets me know that cranial nerves 3, 4, and 6 are working in order. The next thing that I'm going to go ahead and do is ask you to look at this again. And we're looking for her eyes to converge and accommodate. The next thing that I'm going to do is a pupillary light reflex. So I'm actually going to shine this light in your eye. And I'm looking for the pupil to constrict. Wonderful. Look at me, sweetie. Wonderful. I do see that both eyes constrict. And so we can say that the pupils are equal, round, reactive to light, and accommodate. The next part that we're going to look at are your ears, okay?
Okay, Mama.
Alrighty. So I'm just going to palpate the external meatus. I'm looking for any lumps, flakiness, redness, any areas of soreness. Does that hurt at all, sweetie?
It hurts like when you...
Just when I squish tight?
Yeah.
Okay, sorry. It's a weird feeling. I'm also going to be inspecting for any extra cerumen near the internal canals, anything like that. So we're going to play a game next. I'm going to whisper a secret word, and if you can hear it, let me know, okay?
Okay, Mommy.
Happy Thanksgiving.
Happy Thanksgiving.
Pumpkin pie.
Pumpkin pie.
Wonderful. So her gross hearing is intact, and that shows me that cranial nerve number 8 is working well. Next, we're going to go ahead and move on to the nose. And so what I'm doing here with the nose is I'm just, hands down, sweetie pie. I know it's a weird feeling. I'm actually just going to palpate the nose. I'm checking to see that it's in the midline and that it's symmetrical on both sides. Does that hurt at all?
No, Mom.
I feel no lumps, there's no areas of warmness, there's no scratches, redness, bruising, nothing like that.
Okay.
Next, we're going to test the patency of your nose. So I'm actually, in this case, going to put my finger over your nostril and have you breathe in and out. Wonderful. That nostril is open and out. Wonderful. That nostril is also patent. And so that helps us to see if you're able to breathe clearly through your nose. Does that make sense?
Okay.
Great. Are you okay to keep going, or do you need a break?
I'll keep going.
Okay, great. The next thing that I'm going to inspect is a little bit of facial symmetry, and so I'm going to be looking at cranial nerve number 7. I'm inspecting the symmetry of her eyebrows, right here, her nasolabial folds, the corners of her mouth. Can you smile for me? Can you lift your eyebrows? Can you frown? And during that time, I'm just looking that the corresponding areas are moving in the same fashion at the same time, and that allows me to know that cranial nerve number 7 is intact and we have no cause for concern. Next, sweetie, we're going to look at your mouth. And so just upon inspection, I'm going to be looking at your lips and the surrounding area and making sure that your lips are pink and moist. And can you go ahead and say, ah? I'm looking at the internal buccal mucosa, ensuring that it's pink. No areas of scratch. I'm also at the same time checking the dentition. Can you smile like this? And ah. I see that we do have some grown-up teeth coming in, and most of our baby teeth have fallen out. Madeline has no cavities, and we do have a loose tooth on the lower left premolar. Wonderful. That's exciting. Let me see the top of your tongue. Pink and rough and bumpy. The bottom of the tongue is pink and moist and smooth, and we can see it's important to check this area. All right, and can I see the top of your mouth? All right, and we're looking for the hard palate to be hard and firm and the soft palate to be smooth. Next, I'm going to actually have you open up your mouth and say, ah.
Ah.
One more time.
Ah.
Try to do it. Open your mouth and say ah when I say ah. Ah.
Ah.
Great. So in that exercise, I'm just looking for the uvula and soft palate to be lifting symmetrically during the time that she's saying ah. And that shows me that cranial nerves number 9 and 10 are intact. And last but not least, you're going to like this one. Go ahead and stick out your tongue at me. Great. And we're just looking for that tongue to come down the midline again, showing me that cranial nerve, in this case, cranial nerve number 12, is intact and working. So if you're feeling good, we can continue on to the neck.
Okay.
Are you ready?
Yeah.
All right. Upon inspection, what I'm looking for initially is to see whether or not the parotid, salivary, or thyroid glands are pink, bulging, inflamed, swollen, or look as though there's a cause for concern. At this point, I don't see any cause for concern, so I'm actually going to have you touch your chin to your chest, look all the way up, ear to your shoulder, ear to your shoulder. If you like to loosen it up, you can just go all the way around. So the range of motion is definitely intact for her neck. The next thing that I'm going to have you do is just shoulder shrug against my hands. Perfect. And turn your face against my hand. And turn your face against my hand. So her shoulders and face are bilaterally strong, and this shows me that cranial nerve 11 is intact. The next thing that we're going to do, I'm going to check your lymph nodes, okay? And so
What's that?
lymph nodes are part of our immune system, and they help us stay healthy. They help fight infections, and they're kind of like a breeding ground for white blood cells.
Okay.
And so the areas that I'm going to be checking are right here on your head and neck. And so I'm going to start with something called the preauricular. This is right before your ears. The postauricular, right behind your ears. We have the jugular-digastric, the superficial cervical, the deep cervical chain, which kind of moves down the neck, the submental, turn your head like this, the submandibular, the posterior cervical, the occipital, and if you could shrug your shoulders, I'll check the supraclavicular, which on peds is a little harder to get in there.
Because my beads?
Yeah, you have a necklace and you're a little smaller. Wonderful. Next thing that I'm going to do, sweetie, is I'm actually going to palpate for your carotid pulse. And what I'm doing is I'm checking that the rate is regular, that the strength is about 2+, which it is, and that the rhythm is regular and the rate is within normal limit, which it is. And this side as well. Perfect. The next thing that I'm going to do is I'm going to use the bell of my stethoscope to listen to this area for bruising. And now this is not something that we want to hear, and so it's important that we listen carefully. We should not be hearing any sounds. So what I'm going to have you do is follow my breathing pattern. Breathe in and out, and then we're going to not breathe for a couple seconds, but you'll be just fine. Ready?
Okay.
Follow. Perfect. I hear nothing. Now let's listen to the other side. Perfect. I hear no sign of bruit. So next, we're going to take a look at your upper extremities. So what that means is basically like your arms and things like that. So the first thing that I'm doing is I'm just kind of touching the patient to see the temperature. I'm also at the same time inspecting her skin. I see you have a couple stickers on here. Were you playing with your sister?
Yeah.
That's kind of fun, isn't it? But also at this time, especially with peds, I'm looking for any sort of lacerations, bruising, any causes for concern. And upon initial inspection, I don't really see any bruising or anything like that at this time. The next thing that I'll be looking at, as far as your upper extremities go, is also would be looking for edema. Please relax your arms. I don't see any signs of edema. Again, not very common in pediatrics. But the next thing that we'll look at is her fingernails. We're going to be looking at the profile of the nails. And we're checking to ensure that those are less than 160 degrees. Now, if they were not less than 160 degrees, that would indicate clubbing, which is a symptom often related with long-term oxygen deprivation. Alrighty. Then, are you okay?
Yeah.
Alrighty. The next thing that we're going to be checking is the capillary refill. And sometimes people have nail polish, and so we just kind of go around that. But we're looking that all of the capillary refill is less than 3 seconds, and it looks like your capillary refill is less than 2. So that's great. The next thing that I'm going to be doing is taking a radial pulse. Radial pulse is 2+ on both sides, bilaterally strong, normal rhythm, and the rate is within a normal range. Alrighty. Next thing that we're going to do is kind of test the strength. So I'm actually going to have you squeeze my fingers, okay? Oh, that's very strong. So she's definitely bilaterally strong. I'm going to have you put your hands up like you're going to fight someone. And what I'm going to do is I'm going to push and you're going to push against me. Perfect. I'm going to pull and you're going to pull against me too. Pull, pull, pull. And honey, just with your arms like this, okay? Pull your arms up. Wonderful. You're definitely bilaterally strong. Can you hold your arms out and even? 5, 4, 3, 2, 1. Perfect. So the next area of the exam that we're going to do, and you're okay to keep going?
Yeah.
Okay, great. The next area of the exam that we're going to focus on is the respiratory. And I can see just upon my initial inspection that the patient is breathing regularly.
Mom, I have a question. What's respiratory?
Respiratory means the way that we breathe.
Oh.
And so I can tell upon inspection that the patient is breathing in a relaxed manner. She's not in a tripod position. I don't know any use of accessory muscles. There's no bulging in the intercostal spaces up here that are visible to the eye. And so at the same time, I'm also going to be inspecting posteriorly. Honey, if you could just scooch, just turn your body this way. I'm going to be inspecting posteriorly the symmetry. Take a deep breath in and out. Looking for both sides to rise and fall equally. And if you could turn around and face back front. Anteriorly, take a deep breath in and out. Looking for, again, both sides to rise equally. I can also tell that her anterior to lateral ratio is a 2-to-1 ratio, which is normal. And if that wasn't normal, or if it was 2-to-2, or skewed like that, that would indicate barrel chest, which is created after a long time of using accessory muscles, sometimes common in patients with COPD. But again, in peds, we're not really seeing a whole lot of that just yet. The other thing that I'm going to do right now is I'm actually going to listen to your breathing. So I'm going to have you relax. I'm going to have you relax. I'm going to have you breathe in and out just a little stronger than you normally would. Relax your arms. Take a deep breath in and out. Wonderful. I'm noting to go side to side and then down. Side to side and then down. Comparing sides laterally. Are you okay breathing like that? Okay, another deep breath. Is it making you yawn?
Yeah.
Okay, take a breath. Now, because in peds she does have a smaller chest frame, we might not get the usual amount of areas to listen to like we would on an adult, but we definitely still want to follow that rib cage, listening to all areas of the lungs. All right, so then I'm actually going to have you turn like you did before so I can listen to your back. And back here, it's the same thing. I'm starting up, following the clavicle, nut on the bone, moving side to side, going down each rotation. Deep breath in and out. Wonderful. Deep breath in and out. Deep breath in and out. Again. Mm-hmm. Mm-hmm. Now, as we come over to this left lobe, we do know that there are 2 areas to listen to on this left side. So, sweetheart, if you could lift up your arm, I'm going to be listening here. Deep breath in and out. Deep breath in and out. Perfect. Now go ahead and turn this way so I can get your right side. And so over here on the right side, there are actually 3 areas that we're going to listen to in a tripod formation. Wonderful. Great. Thank you so much. I know that was a lot of breathing. So as I was listening throughout, the sounds were clear. I did not hear any presence of any musical wheezing, any crackling. I heard no bronchi. So I would say that the breathing sounds are normal. I definitely was able to differentiate between the bronchiovesicular, and vesicular sounds and the different notes that they took, with the bronchial ones being a little bit deeper, more shallow, and the vesicular ones being a higher, quicker pitch. And so I know this is a long exam and we're almost done, so I just have a couple more things for you to do. Would that be okay?
Uh-huh.
Alrighty. So we're going to change things up just a little bit. I'm going to have you go ahead and lay back. We can move the pumpkins to the side. I'm going to move on to, how about we put our head over here then? You're a little taller than I remembered. Go ahead and lift up your head. Let me get one more pillow. All right. Ups to daisies.
I'm just living on.
All right. Now you can lay back a little, okay? Try to get you at a 30-degree angle. So the very first thing that we're going to be doing with the cardiovascular system inspection, or assessment, I should say, is that initially I'm looking at the jugular veins, and ideally she would be at a 30-degree angle. In a home setting, we don't necessarily have that advantage of having a bed to scale. And so really what I'm looking for in these jugular veins is that they're flat and that there's no bulging or no visible palpation of those veins. And if you could turn your head this way, sweetie. And as you can see again, the vein is flat, there's no bulging, no areas of concern. You're doing okay?
Uh-huh.
The next thing that we're going to go ahead and do is take a listen to the aortic, pulmonic, tricuspid, and mitral valve. All right, sweetie, so first we'll start with the aortic, pulmonic, tricuspid, and mitral valve. Great. And the next thing that I'm going to do is I'm actually going to use the bell of my stethoscope to listen to the same areas again. So we're again going to start with the aortic, pulmonic. Go ahead and put your arm down flat and relax. Tricuspid, and then last but not least, we're listening to the mitral valve. So what I heard was S1 and S2. I heard a regular rhythm, a normal rate, and really I didn't hear, what is most important is that I didn't hear a more murmur, and I didn't hear any S3 or S4 as part of that. Last but not least, in the fifth intercostal space, mid-clavicular, we would be listening to that apical pulse, and so I'm just going to go ahead and do that and do a quick count as well, just to kind of see where we're at with that.
I'm doing shorter.
So, like I said, this would be the fifth intercostal space, mid-clavicular, so we're right here. Okay, so her pulse is a little faster right now. It is a 96. Sometimes in pediatrics, the pulse can be a little bit higher, and so that doesn't surprise me. Again, this is also a little bit of a stressful situation for a kid to have to sit here, so I'm not surprised that her pulse is a little higher than average. The next thing that we can do is move on to the abdomen if you would like. For this one, I'm going to remove a couple of the pillows and just have you lay flat and do one pillow, okay? Are you able to lay flat?
Uh-huh.
For this part of the exam, I'm actually going to need to come down by your feet, so I'm going to have you turn around and put your head this way. Does that sound good? A little repositioning here. Wonderful. Go ahead and lay down. And I'm actually going to be inspecting your abdomen, so I'm going to go ahead and expose your tummy, okay?
Okay.
Alrighty. And so upon the initial inspection, I'm just really kind of looking for the contour of the stomach. I'm making sure the camera can still see. So I can see that the stomach is a little rounded. And then I'm also going to be coming down by the feet to inspect the symmetry, making sure that both sides are equal. Please put your hand down, sweetheart.
Okay, Mommy.
Wonderful. There's no need to flex your tummy. The next thing that I'm going to be doing as part of my inspection is just looking for any movement, any aortic pulsation, of which I don't see. I just see the normal respirations. At this time, we're also inspecting the skin as well, looking for any nevi, moles, birthmarks. At this point, I don't see any, put your arms down, please. I don't see any moles or nevi, freckles, anything of that sort. And so the next thing that I'm going to do is I'm actually going to go ahead and listen to your stomach. I'm going to put my stethoscope on your tummy, and I'm going to move in a clockwise circle, listening to all 4 quadrants. Are you comfortable with that?
Uh-huh.
Alrighty. So the book did say to start in the lower right quadrant. Sometimes I mix it up and start in other places, but for accuracy's sake, I'll start right here, and I'll move all the way around, just kind of listening. And how long ago did you eat, Madeline? About half an hour, 20 minutes ago?
Like maybe more than 20 minutes ago.
A little while ago? I definitely hear some,
some
turkey sandwich. Okay, so I definitely hear some hyperactive sounds in her upper 4 quadrants. And in the lower quadrants, it's a little quieter, but that's to be expected. She just ate recently, and so those upper quadrants were really easy to hear. So I'm actually going to have you continue to lay on your back. We're very close to finishing. The last thing that I want to listen to is with the bell of my stethoscope. I'm actually going to be listening to the aortic, renal, and iliac arteries, and just kind of screening, ensuring that there is no bruit. We don't really intend to hear much of anything in this area, and so please hold still. So the aortic artery is just about 1.5 inches above the umbilicus. And I hear absolutely no bruit. The renal arteries are just slightly to the right. And the iliac, just slightly lower than that. Wonderful. I hear no bruit. So you can actually go ahead and sit up and put your shirt back on. Thank you for being such a good sport. We just have about 2 or 3 more exams, and then I promise we can be all done, okay? Alrighty. The very next thing that we're going to do is scooch on down so our wonderful friends can see us. Alright, so the very next thing that we're going to do, honey, is a little bit of neurological stuff. And so for this one, it's called the Babinski test, and it might be a little silly. So what I'm going to actually have you do is sit back on here and lay down. I could have done this while you were laying. And what we are doing, the bottom of our patient's foot, I will take this and rub it across. And the natural reflex is for them to curl their toes or pull away, but not to flare out. And so if they're ticklish, they might just pull away a little more, especially in peds. And so she does have a negative Babinski test, so that is a normal finding. You can go ahead and sit up now, sweetie. Let me get my cotton wisp.
What's a cotton wisp?
You'll see. All right, go ahead and sit facing Mama.
Is that a Q-tip?
It is. I'm pulling off this part to make a cotton wisp. And then we have a sharp one for later. Okay, so what I'm going to have you do is actually just close your eyes completely, and I want to see when you feel this cotton wisp. When you do, please say now.
Now. Now. Now. Now. Now. Now. Nah.
Wonderful. The next thing that I'm going to have you do is close your eyes, and we're going to do a distinction between dull or soft. Or I'm sorry, sharp or dull. So I'm going to attach this
What's
to you.
dull?
Dull means soft. This means sharp.
Ow.
So you're going to tell me with your eyes closed whether or not this is dull or sharp.
Sharp. Dull. Dull. Sharp!
It's not that sharp.
Sharp. Soft. Soft.
Dull.
Soft. Dull. Sharp.
Okay, you can open your eyes now. So you did have a normal response to that, and you were accurate, and so that shows me that your sensory nerves are intact and working well.
Mommy,
The
that
next thing
sharp
that-
kind of hurts.
Okay, the next thing that I'm going to have you do is actually a reflex test, and unfortunately we don't have a reflex hammer here at home, but what we would do is hold one thumb over this tendon, relaxing the arm, and we would actually strike right here on top of the thumb, and we would expect to see a tendon reflex. Also, we would do the same right here upon the knee, and we would again expect to see a tendon reflex. Please be nice, okay? So we would expect to see reflexes for both areas there, both for the elbow, for the biceps, as well as the patellar. Now I have a few fun things, and I guess you could stand on the table so we don't have to adjust the camera.
Yay.
Go ahead and stand up. Hands down. I'm going to have you just kind of walk from one end to the other. Look this way and walk. Now once you get here, I'm going to have you turn around and walk heel to toe. So, yep, put your heel right in front of other foot. Heel right to your toe. Perfect. And do that all the way to the edge of the table. Heel to toe. Both feet. So with pediatrics, it's a little bit more difficult to explain what we're exactly looking for. So I'm going to have you look down and watch what I'm doing. Heel to toe. And heel to toe.
Okay, I get it.
Get it? Okay, let's try. Let's give it one more try, guys. I think she'll get it this time. Perfect. Heel to toe. And heel to toe. Wonderful. Perfect. Can you go ahead and sit down? So she did have a normal response in being able to do that. I'm going to actually have you close your eye, or not close your eyes this time. Keep your eyes open. We are going to do the finger to nose test. I'm going to have you will find out.
Okay.
I'm going to have you touch your nose and touch my finger as fast as you can. Ready? No, not as fast as you can, as accurately and as quickly as you can. Keep going. All right, wonderful. So that's also a normal finding. So I'm going to actually have you stand up again. I know, when do you get to stand on Mommy's table? Never. So this is a fun treat for her. So if you could actually take your heel and rub it down your shin just like Mommy's doing. And if you could do it again with the other side. Perfect. Go ahead and have a seat now. I'm going to actually ask you to stand on the floor for this one. Go ahead and stand right here. Stand with your hands, close your eyes, and just stand still with your hands by your side without moving. Just stand still. What I'm looking for is to see, this is called the Romberg test, and what I would be looking for is if her feet were spreading apart. Keep your eyes closed, please. If her feet were spreading apart or anything like that, so she is negative for the Romberg test. Alrighty, you can go ahead and sit back down on the table, please. Nextly, we're going to be looking at her lower extremities. And for this part, I might get you another pillow. All right, so the very first thing that we're looking at is her skin and the temperature. And so just go ahead and scooch back a little. Go ahead. And so the first thing that we're looking at is just kind of the skin. I'm looking, especially with pediatrics, we see all the time bumps and bruises and scrapes and cuts. So it looks like you have a little mark here on your knee, honey. What's that from?
Oh, what?
A little mark right here.
Oh, that's like a marker thing or like fuzz.
Okay, go ahead.
Yeah, that's fuzz.
Maybe a little scrape. Go ahead and lay back. And so we're just kind of looking at the skin, just looking for lacerations, bruises, cuts, scrapes, and again, like I said, I'm surprised that we don't have a few more today because it's very common in peds. The next thing that I'm going to be looking at, again, was the temperature, just kind of making sure that our legs are warm. It is a little cold, so it's suspected that her feet would be a little colder. Also, even though we're young and hair distribution is minimal, it still is present. And so I'm going to be looking closely for hair distribution, making sure that it's even throughout. Now, with an older adult, if we saw shiny skin with minimal hair distribution, that would let us know that there was some type of venous return problem and that perhaps the lower extremities were not getting adequate blood supply. And so in this case, we do have an appropriate distribution of hair. I don't see any venous, any visible varicosities throughout. And the next thing that I'm going to have you do, Madeline, is just kind of hold still so I can get a good pedal pulse.
What's a pedal pulse?
A pedal pulse is the...
oh, that we should.
Okay, shh, Mommy needs to finish. We're almost done. So I am noticing that we have a good pedal pulse. It is bilaterally strong, of 2+. It is a normal rhythm. It's within a normal rate. I don't notice any swelling or edema, anything like that. The next thing that I'm going to have you do, Madeline, is I'm actually going to have you lift this leg for 5 seconds. 1, 2, 3, 4, 5. Wonderful. Next leg, please. 1, 2, 3, 4, 5. Go ahead and bring this leg out. And bring it back in. And this one as well. And this is just testing the range of motion. Can you do it again one more time now that you know what I expect? 1 and 2. Now can you go ahead and bend this knee all the way up as high as you can? Perfect. And the next one. And so this again is just checking that her range of motion on her lower extremities is bilaterally strong. And not only that, just that it is there and there are no issues, pain, or anything with that. So we only have one part left. So I think you'll be happy about that, honey. We do have to check your back. So I'm going to have you stand on the floor and I'll just kind of adjust the camera a little bit so we can get a good glimpse of what we're doing. I think that should be sufficient. Is it? We can stand a little further back. Okay, great. So for the back, what I am looking at back here is for symmetry of her shoulders, her back, the gluteal folds back here. And I think I'm just going to look, okay. Wonderful. I'm also checking the skin as always, just constantly looking for nevi, anything like that, any cause of concern. And so the next thing that I'm going to have you do, honey, is I'm going to have you bend over and touch your toes.
Okay, I kind of feel something like here.
Okay. And so I'm just kind of checking for that spine to be straight. I'm going to have you stand back up. And let's turn this way so the audience can see. I'm palpating that spine. Checking, is that painful to you?
No.
Okay. As I come down and look at her laterally, I'm looking that there is a convex contour to the thoracic area and then a concave contour to that lumbar area. And so that's definitely present there. The last thing that I would like for you to do, and then we can be all done, is put your hands on your hips like this and twist your spine left and right. And that shows me that your range of motion is there. All right, Missy, you did a phenomenal job. I'm so thankful. Go ahead and have a seat again if you like. That concludes our head to toe physical assessment. I'm very grateful for Madeline, your patience, and thank you everyone for watching.
Bye.
See you in class.
Thanksgiving.
Happy Thanksgiving. Now, how do I turn this thing off?